get any noise. You can stand actually right here.
We're good?
Okay. I'm Dr. Samuel Baharestani, an oculoplastic surgeon here in Smithtown, New York. We're going to be doing a live demonstration of Restylane filler injections. We're going to be starting with underneath the eyes, treating the area called the tear trough. We have a patient who's been injected before. She loves the results, and kind of the filler has worn away. The body has broken it down, so now she's ready for more filler injections, and we're going to be doing that right now. So usually we'll start with cleaning the area that's going to be treated. We're going to use a little alcohol in that area to get it started. Our patient has been pre-treated. You can rest your head back there. Our patient has been pre-treated with a little bit of ice to the area to help numb it and to control bruising afterwards. Great. So I'm going to point out a few things before we get started. You can open up your eyes. So we're looking at the dark circles and the little bit of hollowing between the cheeks and where the eyelid begins. You can see it on this side as well. There's a little bit of a dark circle where the eyelid ends and where the cheek begins. We're going to be filling in that tear trough to get rid of the dark circles underneath and to kind of mask the eyelids and have it blend a little bit better with the cheeks there. Okay, so you can close your eyes there. All right, here we go. So first little injection, you can feel a little pinch. Now the filler itself has some numbing in it, so any areas that we start treating over and over again will start to get a little bit numb. Patients will feel that first little pinch as it goes in, and then it starts to get numb from there on out. These injections, it's really important to be injected in the right area. I know you're feeling it there a little bit. Because with the thin skin of the eyelid, if the filler is not injected in the right area, patients will be left with a little bit of a bluish hue, or what we call the Tyndall effect. You'll see that I always massage it after we place the filler, just to make sure there aren't any lumps or bumps, and the filler kind of blends in well with the skin underneath. You're doing awesome. Perfect. And we'll just massage that. Great. Okay, so let's get some ice on that side, and then we're going to switch over to the other side. So the filler injections actually go pretty quickly. We switch over to this side and do the same thing. Do we have a new ice pack?
Yeah, I need a new ice
pack. All right, so let's grab a new ice pack there. And same thing on this side. So we go right across that orbital bone, down all the way across to kind of work that filler in, blending the eyelid with the cheek a little bit better. Like I said, the area that we're injecting, or the depth of the injections, is really the most important thing to make sure that we don't get any bluish hue or Tyndall effect, any later swelling that may occur. Okay, perfect. And we are all done. So you see the tear trough fillers actually go pretty quickly. Just massaging it in, make sure that we don't have any lumps or bumps, gives it a nice natural result. You can put that down for a second. And you can see that it's done a really good job of masking some of the darkness underneath. We've blended the eyelid with the cheek a little bit better. Over the next couple of days, the filler injections will actually draw some fluid into the area, and that helps it to look even nicer over the next few days. So we're going to have you place a little bit of ice there to make sure you don't get any bruising. How was it in terms of pain?
It was fine.
It was fine, yeah. You just feel the injection going in, but then it starts to get numb, and the injections go so quickly, so it's not such a bad thing to have done. So thank you for joining us for doing these tear trough fillers tonight. We're going to be doing some other fillers, so please join us for the rest of the presentation tonight.